Hello guys, welcome back again. Sorry for coming up late. I was having technical errors. Sometimes when I want to share my screen for a live section, I don't know. Can everyone hear me? Let's see. I was having okay. So okay. Give me a second. More people can join. So we are going to be discussing the Nclex most tested topics. So a lot of people were asking, so I decided to come up and share some of this information with people that will be interested in taking advantage of it. All right, so my name is Nurse Rachel. I am a registered nurse in Nigeria, the US, and Canada. I share information that help nurses and any important immigration updates. So if this is what interests you, please don't forget to follow my page and always share my posts with your friends and loved ones. So let's see. All right. So in this video, we'll be discussing some Nclex tips and Nclex most tested topics. So from the screen here, this is a material called Ultimate Study Guide. But this is not the major thing I want to say today. But I just want to share this information just in case you're just starting your studies or you're planning to start, you would know that Nclex is doable. Okay, so you don't need to be scared of anything. You just have to start studying. Once you started your evaluation or once you've started your evaluation or any process regarding the Nclex, you just need to start studying. All right, so from this material you can see on the screen leadership management. So the tips include pick an answer that is more global. Sometimes in some questions you may get questions that has two answers that looks exactly the same or two answers that looks opposite. Okay, so it says we need to pick an answer that is more global. If two answers says the same thing, neither is right. If two answers are opposite, one of them is probably right. All right, so rule out absolute words like never. Okay, so for high risk for infections, patients with cellulitis, osteomyelitis, open wounds, COPD, CKD, DM, patients on hemodialysis and infectious diseases. Also immunosuppressed patients, example patients with cancer, patients on steroid therapy, fresh post-op patients, um, patients of on okay splenectomy, that is patient that is fresh post-op. All right. Mm-hmm. Sepsis, pneumonia, sepsis like infections like pneumonia and fever. Okay, so these are high risk patients. This one's marked on red. So Low risk for infection includes pelvic inflammatory diseases, that's PID, urinary incontinence, dementia, GI bleeds, and patients with nosebleeds. So room assignments, pairing high infectious patients with patients less susceptible to infection. So you need to pair patients with high infection rate with patients that haven't got that is not more susceptible to infection. So should not assign a floating nurse with a new patient or discharge. All right. So most tested topics include prioritization, delegation, staff management, and ethics. Then for fundamentals, important pointers, you have the procedures, and for and cultural competence, that's cultural considerations, and all those information. I told you guys that if you're just starting, you need to um start with the sounders. Okay, you need to start with the sounders. But if you don't have time, you can just go ahead and use the systems just as is provided on the screen here. So for example, if you're doing respiratory, you can go ahead and watch videos on all the topics that are in respiratory. Okay, so for adult health, it says assess level of consciousness, um, which includes airway, breathing, and circulation. Establish an airway if patient is unconscious. Assess patient first before calling the blue code. So if patient the blood pressure is low, you give NS fluid bolus. Okay, so for CV and PV, respiratory, neurological, musculoskeletal, GI, nutrition, GU, immune, endocrine, hematology and oncology, reproductive and sexual health, infectious diseases, visual and auditory, and integumentary. So important pointers for pediatrics, you watch out for signs and symptoms of pain. For children, you watch out for their facial expression, whether they are frowning, clown jaw, legs. On the legs, you watch out for kicking of the legs or legs drowning up, tremors. So activities, you can look out for arcing, rigidity, jerking, or fixed position. So cry, steady scream, sobs, or difficult to console. So these are important pointers you need to look out for when it comes to checking out for signs and symptoms of pain in children. Normal and abnormal signs and symptoms. Developmental milestones. So I've gone through this before. So for maternity, you check out for fetal heart rate, antepartum, postpartum, and newborn. You also need to go through everything that has to do with critical care, major conditions, therapy, and treatments. All right. So for mental health, you also go through the all the topics that are under the mental health conditions. You get to know the therapies and treatments that are under this topic and system. Okay. So also These are some test taking strategies that you also need to consider while you're preparing for the NCLEX. So you should also know that acute problems beat chronic. For example, a patient is complaining, or a patient that has CKD is complaining of severe pain, something that just started that is sudden. You should know that this patient should be considered first before a chronic condition. So you should also take note that you should know when some signs and symptoms in a question is expected. Okay, you should also know when a patient is displaying signs and symptoms that are expected from that condition, because most times these may be a distractor in a question for prioritization and for prioritization questions. All right. So acute problem will always beat chronic. So example, COPD patient with shortness of breath, diaphoretic patient complaining of chest pain. So I told you when a patient is experiencing any sudden change, you should also know that this patient should be considered first. All right. So take note of patients exhibiting expected signs and symptoms. All right. So worsening conditions keyword. So when a condition is getting worse in a patient, patient complains of sudden change, or you observe a sudden change in patient labs, you should know that you need to keep an eye on this particular patient. So the keywords you may expect: new, acute, or sudden change in, for example, blood pressure, pulse and respiration, or patient abruptly stopping their medications like steroids and beta blockers. So you also need to consider some of these patients when you're taking those prioritization questions. All right. So if there is rapid weight gain, for example, in heart failure, you also need to consider this patient as priority. When you're doing priority questions, sometimes they will just give you a question telling you that an old man, age doesn't really count when it comes to taking questions in the NCLEX. Okay, you just have to know the person you need to attend to immediately. All right, so an old man that has CKD, and they present typical signs and symptoms that comes with CKD, and a patient 2 hours post-op that is complaining of severe pain, you should know the patient you're going to select when it comes to that. Acute always beats chronic when it comes to prioritization. And age is not a determining factor for you to select a patient to give priority to. All right, so organs in order of priority. So first, you need to consider the brain, the lungs, the heart, the liver, the kidney before the pancreas. So this is the order of consideration. Okay. Hold on. All right. So you need to consider the brain first, the lungs, the heart, the liver, the kidney, and the pancreas. So this is the order of consideration from the organs. Also, when you're prioritizing patients, you need to consider airway, breathing, and circulation. So ensure that patient's airway is always patent. So if neck injury is suspected, jaw thrust technique is used. All right. So Breathing, assess respiratory rate, depth and effort. You provide oxygen as needed. For circulation, you check patient blood pressure, pulse and perfusion. Then you give IV fluids as prescribed. Never neglect pain in a patient. Patient complain of sudden pain or ongoing pain that is becoming more severe, most especially in patients with sickle cell. You don't ever neglect their pain. In fact, they are always priority when it comes to pain management on the Nclex. So as long as the patient has sickle cell and they are complaining of pain, you always need to attend to them. All right. Okay, so you need to understand the normal structures and functions of each system when you're studying for this exam. You need to understand the anatomy and physiology of every system. You need to know what is going on the body for you to answer the Nclex questions. You need to know what's going on. You need to know what is going on for you to answer some of these questions correctly. You don't need to cram. You don't need to, you know, copy and paste on your brain. You need to read and understand for you to attempt those questions. And please, if you're studying, you also need the question banks. So if you're studying for the first time, you can just go ahead and review the topics, go through them once so you can familiarize yourself with what's really going on there. Maybe the second time you can now read and do questions, because when you read and do the questions, it helps you get very familiar with the question type. So when you do the reading and you do the question, it helps the question to stick and what you also read to stick. Okay. So for neurological and nervous system, you need to know the anatomy and physiology, learn about the brain and spinal cord, learn about the peripheral nerves, you need to know everything about the cranial nerves. You need to know. So when they're asking you what's going on in cranial nerve 1, you can tell that it's coming from the olfactory. If it's cranial nerve 2, they're asking what is going on in the eyes. If it's 3, they're talking about the movement of the eye and all that. So if you don't know some of these things, it may likely be difficult for you to attempt those questions. So you need to learn about the cranial nerves. You need to have it at your fingertips. So these are some common conditions you may likely get on your examination. It includes stroke, multiple sclerosis, Guillain-Barré syndrome, spinal cord injuries, myasthenia gravis, seizures, head injuries, GC scale, increased intracranial pressure, cerebral aneurysm, and all other questions. You can add yours on the comment section. Thank you. All right, so the nursing interventions for anything that has to do with the nervous system focuses on seizure precaution. Most times it focuses on seizure precaution, neuro assessment, and medication administration. So when you get a question that is talking about patient just fell or any neuro question at all, the first thing you need to do as a nurse is to assess this patient. You have to do neuro checks to assess the patient level of consciousness and all that. Then you can also go ahead and if there is injury, you can take this patient to the imaging room and the patient will be investigated before medication. So you assess the neurological function of this patient, check level of consciousness, imaging is conducted before giving medication to any patient that has a neurological defect. All right, so I said increased intracranial pressure is one of the topics. You need to know the ranges of the pressure, cerebral aneurysm. So, and I also said that the nursing intervention focuses on seizure precautions, neurological assessment, and medication administration. So for fall, that is traumatic head injury, is a priority, okay? So you need to assess this patient's level of consciousness. do neuro checks, and start imaging for this patient. For a spinal cord injury at T6 and above, you should monitor for signs of autonomic dysreflexia. So this patient may come down with signs of hypertension, diaphoresis, tachycardia, and even headache. So these are some of the things you need to consider, which is why I always say if you don't really know what is going on in this patient's body, you don't know the signs and symptoms, because you really need to connect the answers. You need to know what is going on. You know the normal, the expected, and the unexpected signs and symptoms of what is going on in this patient's body before you can be able to attempt some of these questions. All right, so for cardiovascular system, we're just going to take neuro and cardiovascular today. Probably as time goes on, I would have to complete the other systems. So please, for my followers asking for the most tested topics, because of the time we have for now, we'll just do two and complete the rest some other time. So for cardiovascular system, you need to understand the heart, the chambers of the heart, everything about circulation, conductive system. If you don't know some of these things, you may not really know what is going on there. Okay. Let me get the other topic. So also for neuro, you need to learn about all the diagnostic tests. Okay, all the diagnostic tests is very important. You need to learn about master the patient's labs. Okay, risk factors. I've talked about GC scale, increased intracranial pressure, head injuries, spinal cord injury, shock, seizures. Um, you need to know for seizure, you need to know the description, you need to know the types of seizures, the interventions during and after the seizure episode. Okay, cerebral aneurysm, stroke. You need to know the causes, the risk factors, the types, and the intervention. Multiple sclerosis, myasthenia gravis, Parkinson disease, trigeminal neuralgia, Bell's palsy, Guillain-Barré syndrome, and encephalitis. So these are okay. Yeah, meningitis is included. Okay, yeah, meningitis. So you need to master some of these topics because it may likely come out on your own examination. Okay, so for cardiovascular system, like I said earlier, you need to master the chambers of the heart. So when they are talking about blood moving from this side to this side, you know what they are talking about. You need to master, get familiar with the conductive system of the heart. ECG is very important. They could throw one or two ECG strips at you on the examination. You need to. That is why you need to understand the conductive system of the heart, because this will help you to attempt some of those questions. Okay. So common conditions include hypertension, deep vein thrombosis, arterial fibrillation, peripheral artery diseases, and peripheral venous diseases. Okay, so myocardial infarction, heart failure, and dysrhythmias. So the nursing interventions for anything that has to do with the heart focuses on vital signs, the labs, and which include, for example, potassium. Okay, so and also for the NCLEX, when you're attempting any question and you don't know what to choose, just make sure you assess this patient first, because you need to assess this patient. You need to know what is going on before you can perform any form of intervention, either giving IV fluids or patient medication or any therapy that is prescribed. The first thing you always need to do for a patient, for the purpose of this examination, is to always assess. So if you don't know what to do for this patient, the answers you're seeing you're not really sure of, pick an answer that is telling you to assess this patient. So for example, they may give you check patient blood pressure, check pulse, check, check, anything check, just check. You are assessing this patient. Okay. So the first intervention focuses on vital signs, labs, which potassium is always the priority to assess for a patient. Okay. So you administer cardiac medication and educate this patient about this ongoing condition, because this patient needs to know what is happening in their body. Educate them on lifestyle, for example, exercising, healthy eating fruits and vegetables, and reducing salt intake, because patient that has some of these heart conditions needs to reduce sodium intake. Okay, so and they also need to modify their lifestyle. If they take alcohol, if they smoke, they need to stop some of these things so they can be able to get better. So these are some of the information you need to put out there before you can be able to assess some of these questions. So also let's go through the other topics. Okay. All right, so you need to know the anatomy and physiology. Okay, diagnostic tests, cardiac dysrhythmias like normal sinus reading, sinus bradycardia, sinus tachycardia, um, atrial fibrillation, premature ventricular contractions, ventricular tachycardia, okay, ventricular fibrillation, asystole, and pacemaker. So you need to familiarize yourself with some of these cardiac dysrhythmia. So when they mention it, when they are talking about it, either they are showing you a picture of what it looks like, or they are trying to explain what it looks like. You can be able to take some of these questions. Also, conditions like myocardial infarction, heart failure, inflammatory diseases like pericarditis, myocardial infarction, and endocarditis. Okay, so cardiac tamponade, valvular heart diseases, cardiomyopathy, renal disease, aortic aneurysm, hypertension, and hypertensive crisis. So these are some questions you may likely get on the NCLEX. It's also important for you to know that delegation is another NCLEX most fact is on everybody's exam. There's no way you take this test and you will not get questions from delegation, prioritization and delegation. 10 to 20 questions, you may likely get them. So you need to know the role of a registered nurse, role of a licensed practice nurse, and the role of an unlicensed assistive personnel. So we may discuss that on the next live section. All right, so the cardiac dysrhythmias you may likely get. So when there is lack of QRS complex, when you're seeing lack of QRS complex in a question or flat line, you just know they are talking about asystole. Okay, so if it's P wave, there is sawtooth, they're talking about arterial flood. I'm sorry I don't have some of these pictures here, but I may likely put them on the comment section, or if you ask for it, or you can just research about it so you will understand more. All right, so when it's sawtooth, you know that they're talking about arterial flutter. When you hear chaotic P wave, it's atrial fibrillation. Chaotic QRS complex is ventricular fibrillation. Bizarre QRS complex is talking about ventricular tachycardia. They can also explain this, or when they are talking about ventricular tachycardia, you can get tomb shaped. All right. So periodic white bizarre QRS complex, it represents premature ventricular contractions. So overall, you need to know the interventions, the medications that is needed for some of these cardiac dysrhythmias for you to be able to also attend some of these questions. The NCLEX is doable. You can do it. There are a lot of resources out there. You just have to start. Okay. Um, I always advise people to start with Saunders. Then, if you're a visual learner, Sarah Registered Nurse and Simple Nursing is a great resource that you can always use to study for your NCLEX. So you can also use UWorld and Archer. So if you're studying with the Saunders textbook, you can either use UWorld or Archer to do your questions. But it's important for you to know that while you're studying for this exam, you need to study and practice, because if you don't practice, you won't familiarize yourself with the question types that may likely come up on the examination. So Sarah Registered Nurse is an important resource on YouTube. Um, Simple Nursing is also okay. They have a lot of videos on YouTube. But if you can afford subscribing to their website, you can go ahead and do that. They have a lot of videos, and on the website it's even more organized. Okay, the videos are organized according to the systems. But on YouTube, you have to type the system you're planning to study or go through them before you can get it. But they organize it system by system on their website. So you can go ahead and look up this information, get their website, and um, subscribe to their website and get all those information. They have videos. They also have questions. So after going through the videos, you can also attempt their question types. But there are some question banks that have updated their questions to the current next generation questions. So you just have to look out for all that so you can be able to attempt the next gen question styles. So I know that UWorld has updated. Archer is also up to date. Bootcamp is also up to date. So if you need any information regarding this, you can always look up those information online and start studying for this exam. Like I always say, NCLEX is doable. You can, you will, and you must pass the NCLEX. There are a lot of study groups out there. If you're looking for friends to join while you're studying for the NCLEX, you can also reach out to me. I have some friends that are currently studying for this examination. So you can reach out to me so you can join them in their group and do some discussions. But before you join some of these groups, you need to complete either a beginners class 1 and 2 and mastery class and all that, so you can familiarize yourself with this, the what the NCLEX is talking about, because they need to brush you up and give you the foundations. You go through the systems with them. I think I've shared an academy I know that is having classes, so they get to teach you everything about the NCLEX. They start from the foundation, but the NCLEX is still something you can do on your own. But if you're someone that can be distracted at any point like me, you can just pay little and take those classes. Do beginners class 1, class 2, mastery, where they train you on how to take the question type. So I think in mastery class you're always answering questions daily. So for the beginners class 1 and 2, you're doing the anatomy and physiology, the disease conditions, and they explain everything you need to know. But once you get to mastery class, you're only taking questions, NCLEX style questions. So it can either be from a personal question bank, or a question bank that will be provided by the academy for you to do your questions. So you really need to start studying for this examination. Okay, so what else am I forgetting? Okay. So we're done for today. If you have any question regarding this discussion, I will always be happy to support you on the comment section. So for people just joining and my new followers, my name is Nurse Rachel. I share information that help nurses and any important immigration updates. So if this is what interests you, please don't forget to follow my page. And for people watching from the YouTube, please subscribe to my channel and always stay up to date with the information I'll be sharing on my page. Thank you guys for joining. I really appreciate you all. I appreciate your support. Thank you for sharing. Thank you for liking and following my page. Have a good day. Bye now.